Hey there. So we're at ViveWell Health, and I've got Flavia here. Flavia, why don't you tell us a little bit about your history, what's going on with you, and where you're going?
Well, so I compete in cycling. I did for many years. And along with that comes a lot of injuries, unfortunately. You know, had clavicle titanium plates here. I've
Hmm.
had a hip fracture. I've been hit by a car, had a concussion. So I can go down the list of things that have happened to me. Not that it's all bad, obviously, but unfortunately, it comes with the territory
Yes.
in a way,
Well, when you play hard, like you end
Yeah.
up getting, you have to take some spills, right?
Yes. Yeah. Unfortunately, always wear a helmet, but there's only so much that can do. And also, with that said, the same amount of effort I put into training, I try to put into healing and recovery,
Yeah.
so you can keep going.
Right. But you're not just the average weekend warrior. Tell us a little bit more about like the level of success you've had and what you're still trying to maintain.
Yeah, so I competed on the road for several years before the pandemic. That I think altered a lot of our lives in general,
Yeah.
right? So up until that point, I was competing professionally on the road in Europe
Hmm.
and went to several world championships and the Olympics. Yeah, so being able to push your body to the limit,
Yeah.
and see what you're able to accomplish is, I think, something that drives all athletes. But there's so much more to that. I started in the sport late,
Yeah.
and so um, I still love doing it. And I have to find a way to keep my body, going because I don't want to hang up the wheels yet.
Yeah.
So
Well, you mentioned something about just even in your family, how having a sibling who's had some significant
yeah,
just physical limitations where you feel a drive, a great example,
yeah,
but of that you can actually achieve anything.
I
And I
agree.
really appreciate that about you.
Yeah, that I think it was a hard, lesson learned in life in general. Nobody wants something like that to happen. But I think the resilience that my brother showed, and also the way my family raised us, to not putting a cap on anything that you put your mind into,
Yeah.
I think I wish more people would think that way because we're more capable than we think we are.
So you're operating from an idea that you can heal and that you can be resilient and achieve
Yes. Yeah.
anything if you put your mind to it.
That our bodies are resilient. Sometimes they just need a little help.
Isn't that true?
Yeah.
So about that then, you came here with some pains, but you were going to Colombia for a
Yeah.
race and you were like, I need something quick. What happened?
Well, I didn't need something quick. I needed something that wasn't going to keep doing more damage.
Yeah.
Unfortunately, when you are in a situation where the only thing that is offered to you is pain management,
You're talking about traditional sports medicine orthopedics
yes,
with cortisone injections
yes,
and ibuprofen.
yes, which
Okay.
I don't take. But like at the same time, I do need that pain to be somewhat under control so I can keep doing what I want to do. And that's kind of what we were talking about. It's like, I don't want that one thing that I love doing to be the reason why I'm in pain.
That's right.
So,
There's a
like,
tension there.
exactly. It's like, what kind of life is that, right? Like, that I think messes up not just your quality of life, but your mental well-being, your psychological
This
well-being.
isn't good for me, but I
This
love
isn't
it.
good for me. I mean, I love this and I can't stand it. So it was kind of like, sometimes it is like that. Even when you're 100%, you're
Yeah.
like, oh my gosh, why am I doing this to myself?
Yeah. But
But
it's so fun.
it is.
Yeah.
But there's also that part where your body's screaming at you. It's like, stop, this hurts,
So then we did an injection in your hip and into some tendons.
Yeah, because you saw my MRI.
Yeah. I mean, you've had some big crashes, and it's showing some chronic wear and tear.
Yeah.
But again, we did some injections, and then in your hip and Prolozone peptides. What happened after your first experience with our regenerative treatments?
yeah, it was incredible. That was mind blown. I'm actually curious to try that with PRP and see what we can do for more like of a long term, you know, result, I guess, right?
Yeah,
like, is
strategy.
that's yes. So that would be incredible to have something that is no longer. I mean, how can I say this? Help my body heal itself rather than continue to do more damage.
But speak about like how your hip felt. You had mentioned
I didn't feel it, and that's like the biggest. Like, oh my gosh, are you kidding me? I don't feel my hip right now.
Yeah. So we had planned on one hip, and you said, "Actually, I'm flying to Colombia tomorrow. Can we do this hip instead?"
Yes.
And then you didn't feel it at all. Then.
No.
Wow. Okay.
That was insane. Yeah.
So now you're off to some races. You're coming back in a month, and we've pivoted to addressing some inflammation from prior head injury, and then we gave you some peptides for to help with recovery, and then we're talking about getting you ready for a summer of really pushing your body. Talk about what's next and what you're looking forward to.
Oh, the concussion protocol.
Sure.
I have yet to understand the whole thing. I know you'll be able to explain that in more detail, but I do think that concussions are something that, honestly, it's a hard thing to navigate. It's a little debilitating. It's more complex than I imagined. And to be able to find ways to, help your brain heal in a way that it's actually, because it doesn't impact just your brain, it impacts everything else in your body. And that's what I didn't realize.
Yeah.
How much of your own chemistry gets changed once you take a hit to the noggin, so
sure.
it's
well, there's a lot of inflammation, and it affects energy production, which affects your hormones, and it affects the way your body is handling stress or thyroid function. Even like the sex hormones, it can push people into menopause sooner.
Wow.
For men, it can adjust their testosterone levels.
Wow.
Growth hormone as well. And then we do have some treatments where we use plasma, like PRP, in the nose to send growth factors and actually stimulate healing. So when you give people those, the different supplements and proteins and omega-3 fatty acids and such, that you can actually use those things better in the brain to help heal.
That's amazing.
So it is cool that we're living in this time that we can actually take charge in what was once like a debilitating illness for people, and just sort of give them.
Think about how many football players have committed suicide.
Yeah.
Sorry.
Athletes in general.
Yes, but I mean, they get hit a lot more often, and just imagine what that does to.
And military veterans.
Yes.
And boxers, right? Soccer players, right, with the headers. But even you were telling me that, I was on a ride with somebody else who had a big fall on their bike, right? And, mountain bike capital of the country, well, maybe there's other places, but you know what I mean?
It's
like
true.
People play hard here, and when you play hard, you fall and you hit your head.
I mean, it can happen running, it can happen driving a car, it can happen. I mean, it can happen. So, and it's even worse when you see now, kids are out there playing or skiing. They, obviously you try to just shake it off. And that's what used to happen a lot. You get up and just like dust off, and and then you're like, you don't even realize that the cumulative effect that it takes. Well,
what's interesting is actually the Department of Defense that really postulated like, maybe PTSD is from trauma and not just a psychiatric illness. And what we see is the fallout after head injury. Really, there's anxiety, depression, substance abuse, anger issues, which then, of course, affects family dynamics, domestic violence, parenting issues. It affects marriages. And then you look at like fatherhood and motherhood statistics of when you don't have both parents in the home because they can't get along because of a head injury,
yes,
then it really affects the outcome of the children. And so it becomes a society problem.
yes.
And so when I think about,
How
taking
that's
care of people's brains is how they interact with their families and their loved ones and their friends, and keeping them active and alive and
it impacts everybody.
Right.
It's
It
like
really
a snowball effect, right? It
Yeah.
kind of is. And then you think about all the other tools you have here. You just talked about the genome.
Oh yeah, the genetic testing, how you can figure out exactly what you need to eat.
Or the disease, things that you can, help yourself or prevent, or if you're going to have, if you have this kind of like this thing in your DNA that you need to be aware of and be able to be proactive, get ahead of the issue before it actually, becomes an issue.
That's right. So
it's
we
incredible.
have a patient who's actually next who has dozens of genetic factors that are affecting chronic anxiety and depression. And we can point to those now and say, hey, these are the nutrients that you're going to need to take for the rest of your life.
Yeah.
And if you know what that is, most people are okay if that's what's going to make them feel better rather than like a pharmaceutical drug. Right? That may or may not be the right thing, and people are guessing.
It's just more depth. It's not a generic thing. It's
very
medicine. Exactly. Yes. Right. Yeah. It's to that person's own specific needs, because we're all different bodies.
That's right. That's right. So you are off. You're doing a big race coming up, a couple of them.
Yeah.
And then you're back, and we're planning on. We have an activated plasma and stem cells in both hips and the back because we're trying to get you better.
Which is so cool, by the way. That whole, like, I don't know how you can help your body just rebuild rather than put a Band-Aid on it. You know what I mean?
Yeah. So we're hoping to fix a torn labrum in the hip. We're trying to fix significant arthritis from massive accidents at like 30 miles an hour. Riding at Olympic speeds. Yeah. I mean, like you are like, I think, in this day and age where we're trying to encourage young ladies to perform, you would be what's called a role model for a lot of people. And I think you being able to point towards a different idea of how to take care of your body is really important.
I think so. I think it's actually really amazing to find a place like this. I just got really lucky. Maybe persistent, because I got to the point where the option that I was given to me wasn't exactly the option that I had was just a steroid shot, a cortisone shot. And you can't do that to your body and expect it not to have consequences, in the sense of it's going to wear your cartilage, or at some point masking that pain is going to be more detrimental than trying to actually fix the issue. That's right. So but it's not, this place is not something that's easily available, or it's not in every corner. It's not like a normal medicine, in the sense of like you don't just go to any place and find something like this. But that's what I'm saying. Like when you have PRP, which also is available at hospitals and stuff, but it's also not covered by insurance.
Yeah.
And like stem cells too. But here you can have all this in one place without having to wait forever to see different doctors and go through that whole, it feels like the washing machine process. You just getting tossed around in this
gauntlet.
Yes, and it feels like you're in a more direct and clear path and tailored to your needs. So I feel very lucky that I have found this place that we can start working towards rebuilding. So
I'm excited for you.
Me too.
Yeah. Well, good luck on your races.
Thank you.
We hope to, we'll see you back when you're here, and then we'll be able to follow you through the summer.
Sounds great.
And see your progress and have you keep at it. And I just want to, again, when I think of a father as a daughter, I have a daughter, and
Yeah.
I think people look at you as a hero, and so I applaud
Oh.
your responsible way that you're looking after your body and keeping after your dreams, even when people have told you should hang it up.
Well, I think we've seen a lot of women that are breaking ceilings, and that's been really encouraging to see.
Yeah.
We talked about Lindsey Vonn, and we like see more and more women that are mothers that are just going out there running crazy fast times and marathons and things that
Yes.
most people would have just said,
Yeah.
"Oh, no way," So I don't know. I think I want little girls to think that they can.
Yeah. Everybody, right?
Yeah, but especially little girls, because
Amen.
I think
Yes.
I think women have always had a little bit of a harder path, especially in the sport.
Yeah.
We weren't even allowed to compete for a very long
And
time.
now it's even
And
more
now-
difficult sometimes.
Yes, yeah. So it's been a journey, and I think we just gotta keep at it, and sometimes you just gotta not worry about what other people think.
Yeah.
And do the best you can, and keep pushing for what you want to see happen.
Well, you're responsible for your health and your body,
Yeah.
and making choices that align with your values.
Yeah.
And anyway, we are on your team, and we're so excited to see you
too.
go out there and compete, and hopefully,
Yeah.
really bring home, some prizes.
Oh, I think the best prize would be to be able to do this and not have pain, and be able to just go out and get the best out of yourself.
Awesome.
Because that's all you can do at the end of the day. Give your best. So it's exciting.
It is exciting.
Thank
Cool.
you.
Looking forward to it. All right.